Hi, I'm Elliot Margolies. I'm from the Midpen Media Center in Palo Alto, California. And since last spring, we've been conducting Zooms that we've come to call our pandemic lives. All of our lives have been impacted by the emergence of COVID-19 since last March. Some of the most devastating impacts are felt in low-income communities. Food insecurity is a reality for many. Rent payments are an ongoing challenge for many. Kids at home instead of being able to go to school is very challenging for many parents that need to get out to work, or for the students who need a place to study and a space to do their homework. Most significant of all, the amount of infections and even deaths are different in communities of low income, often communities of color. So with us today are some of the leaders that I spoke to last spring and summer um, about disproportionate impacts in East Palo Alto and Belle Haven, a part of Menlo Park. So I'm going to turn it over to the four of you to just introduce yourself. Starting, I'm seeing Nevida and Maya, Gina, and Heather.
I'm Nevida Butler, and I'm the outreach person for the Ecumenical Hunger Program. Outreach community worker, person that they call when there's a need for beds, warm coats, and things like that. And a former executive director of the Ecumenical Hunger Program.
I'm Maya Altman. I'm the CEO of the Health Plan of San Mateo. We're a public entity, and we insure the people in this county that are eligible for Medi-Cal. By definition, the people we serve are all low income, and we're very concerned about the impact of the pandemic on our members.
Hi, I'm Gina Sudaria. I'm the superintendent for the Ravenswood City School District. We have 4 schools, and our schools span from East Palo Alto to Eastern Menlo Park.
I'm Heather Starnes-Logwood from Live in Peace. We serve the community in multiple ways, but we focus on the 80 least likely to graduate in high school. And we also have 75 college students that we fund. And we have 14 staff, and we all live and are from the communities. So we have a lot of tentacles everywhere. And we partnered up with 2 other organizations to start first of the month, where we were actively paying rents during this pandemic.
Thank you. When I spoke with the other superintendents along with Gina last August, Gina said she always starts her meetings asking people, how you holding up? Because we've now been through nearly a year of this pandemic world. So I'm going to start there with you each personally, because I know your year has been filled with new challenges, new work. But how are you holding up, Nevida?
I'm doing okay. Some days are worse than others. It's according to some of the phone calls. The hard part, I'm a hugger. I'm really a hugger. And sometimes families that come in, people, they just need somebody to hug them, just stand there and hug them and listen. And so now it's like a fortress over there in the warehouse. I've got plexiglass all around me. And that's very hard for me because of wanting to get closer and really be there for the families that are coming in. And we're getting people coming in that's lost a loved one. Sometimes 2 families in the household that have passed, or people are sick. Makes it really hard. And you know that you need to be strong for those families. And so make it really hard, but I'm so busy. It's when I get people coming in that are telling me how depressed they are and everything, I'm thinking, I don't have that kind of time to get there. So I think that's my savior. Yeah.
I'll move over to Maya. How you holding up?
Well, yeah, I'm holding up okay. I really can relate to Nevida's comment about being busy. I've just been, there's so much to do and there's so much going on. So I don't have too much time to think, and I'm almost grateful for that. But it's hard. I mean, I think it's not just the pandemic, but everything else that's happened over this last year or so has just compounded that with, you know, what's happening in our government. It's better now, but and the civil unrest and the racial injustice. I mean, it's just all so much. It's
Quite a year.
yeah, the world is
Did your
exhausting.
routine change dramatically from before the
Yeah,
pandemic?
yeah. Well, you know, our whole organization is working from home, and we're lucky we can do that. We're very lucky. And I thought, you know, the last few weeks have been the hardest because the vaccines are here. They're just out of reach, you know. And you know, so and I just with the surge in the last few weeks, it's a little better now. I feel like I have to be even more. I mean, what a tragedy to get sick now, you know, when the vaccines are reached. So, and I'm 65, so hopefully I can get a vaccine soon.
Yes, like Nevida and Maya, just time is of the essence. Trying to constantly problem solve is something that happens every single day. I feel like there's something that we need to try to address all the time. If it's trying to figure out how to test staff, how to test students, how to bring students on campus amidst having high positivity rate, trying to build confidence in a community that we can do in-person instruction. So problem solving and trying to be creative all at the same time has been challenging. I think how I cope and try to sustain energy is finding moments to like have a little bit of reprieve. If it's a cup of coffee in my car on my way to work, or having a conversation with my son on the way home, or as soon as I step through the threshold of my home, it's take a deep breath, cherish the moment that I made it home, and I have a few minutes with husband and family to not necessarily recap the day because there's too much to recap, but check in on how other people are doing. And then, I've learned how to compartmentalize and then get back to work later on in the evening. Right now to cope through these times. It's finding moments of reprieve.
Heather, how you holding up?
Yeah, I agree with the team here. There's a year like no other, and I am humbled by our staff. We're a small organization with that do big things. We reopened like April 15th once we realized that none of our kids were connecting. And I think the biggest thing that's weighing on me, probably with all of us, is like what's to come. I feel like we know before it was so what the heck is going on. Now we have like a cadence of understanding what's happening, but I don't think we have any idea of what the loss and what the effects of in our communities.
I'm going to go to Maya and ask her to make any comparisons that she's able to see from her position as CEO of Health Plan of San Mateo between the county as a whole and between the impacts in East Palo Alto and Belle Haven. Maya?
Yeah, so we serve at the health plan, we serve the entire county. We do have many members who live in East Palo Alto and the Belle Haven area, but I'm going to talk about, and this is actually from the county website, where there's quite a bit of data there and it keeps growing, but about there are about 35,000 cases of COVID right now, and there are about 382 deaths to date. And the case rates, the percentage of people in a community that have contracted COVID really varies around the county. So for example, of all places, Colma is very high, 16% rate of COVID. But the highest is Pescadero, 21%. And third highest is East Palo Alto, 13%. North Fair Oaks is 11%. There's no breakout that I could see for Belle Haven. But the county as a whole is about 4.5 or 5%. So clearly the, incidence of COVID is concentrated in certain highly concentrated in certain areas. The deaths, I don't have a breakout of the deaths by community, but we know that about 37% of the deaths are from people who are long-term care, older people, and we know that we looked at our death rates of our members. We've had about at least 90 members who have died, but we think the number is much higher because we just get data from the hospitals. But the highest percentage of those are Asian, actually. We have a lot of older Asian members, but the Latino percentage is pretty high as well. So we have about, over 20% of the deaths of our members have been among the Latino community.
It was mentioned that vaccinations are just about here. You were saying you're looking forward to getting yours.
Yeah.
But I'm wondering, how are the members of the plan, the health plan, responding to vaccinations? Are they taking them? Are they getting them? How is it breaking out now?
The county has been working really hard to make sure its allocation goes to people in the safety net. So for example, Nevada and I were talking about the Saturday event at Ravenswood, the vaccine event. And so that was a county allocation of 1,000 vaccines to Ravenswood Family Health Center for people in the community. I don't think you even had to be a patient at Ravenswood. And they've been working closely with us while we've been trying to set up vaccine clinics that are focused on our members. And so we're not advertising them widely, we're just advertising them among our members. And the take up is really good when people hear about it through a trusted source. And when they call up and say, hey, there's a vaccine available, you can sign up, people listen and they sign up. Or if a friend calls up or a relative. But if we, to reach a lot of people quickly, we do robocalls, very little take up. And so we're experimenting with different ways of communicating, but we haven't, because there isn't a lot of vaccine available for our members yet, we haven't just really gone out and pushed it because we don't want people to get frustrated, when they can't get a vaccine shot. I want to say I really recommend that everybody go to the county website and sign up on the vaccine, because that way you'll hear about when vaccines are available, not just for yourself, but you can tell friends and community members as soon as they're eligible. The people at the county are really heroes. I mean, public health has been working so hard. They hear on Wednesday what the vaccine distribution is going to be for the following week. And so sometimes it's much lower than what they expect, and sometimes it's higher, and they're just scrambling all the time to set up events.
So let me move over to Nevada Butler. Food insecurity is in the title of your agency, Ecumenical Hunger. But in this past year of the pandemic, have the needs multiplied? Are you getting requests for things that you never used to before? Has the job changed of what the Ecumenical Hunger Program is trying to do?
A lot has changed with it. We continue to put the food in the cars drive through, most of them, but we do have people that are walking up. And the big changes are not only food, is do we have detergent, cleaning supplies? I get that all the time, dog food, cat food, but the requests don't stop coming in. And interesting requests, big requests for warm blankets, and we're not getting the blankets in that we used to get in. That's been interesting. And not a lot of the coats and things. We usually got a coat drive where hundreds of coats would come in and larger sizes. We're getting a few of the smaller size, but not larger size coats and things. And that, I guess, because people are not working, I don't know, it's just really, you never know what people are coming in to ask for. And still a lot of calls with the help with rent, continuous help with rent, PG&E, to fix a car that's broken now. People just don't have funds to do it anymore.
Mhm.
And it's frightening.
Are you seeing it get better now, or or can you imagine the next 6 months?
I'm not sure. I think it's up and down. I think a lot of that is because of the other groups that are providing food. The school district, I'm told, and so I asked yesterday when I was doing some inquiring, I thought all of us should have information where food is being served other than EHP. And I like the word of mouth, even with getting the COVID. When people hear things from people that they know and trust, they will go and do it. And I did tell the director, every staff person that work here should be a resource for emergency food when this office is closed. But the food request, it's up. In some weeks it's worse than others. And I would say maybe closer to the first of the year, I had a neighbor that called me last Friday to see about getting food, even though we don't usually serve on Friday. If people call and ask, and we had quite a few people that came in on Friday to get food. And my biggest concern when I was talking with him yesterday is a long weekend without food. And so you want to know all of those resources that are open on the weekends where people can go and get food.
Yes, Nevada, we are providing meals for any children who are 18 years and under in the community. When the pandemic first started, we were distributing meals from all of our school sites daily. We got feedback, though, that it was really challenging to keep parking spots at apartment complexes because everyone was at home. And so a lot of our families thought we're fine with distribution of food 2 times a week or on specific days. So then we minimized it, decreased it to 2 times a week. And now we find that it's actually better that we do it 1 time a week and we have enough food for the entire week that we distribute. And the quality tends to be better because you're doing bulk size. So you do a gallon of milk, right? Carton of eggs and things like that. We also host sites for second harvest at the Ravenswood Middle School.
Tell us in terms of what you see with people having lost jobs, if some of those are coming back and you're seeing less unemployment or underemployment, or what do you see? Has it changed at all?
I think just that examining like the thin line that our community is living on. And so any loss of income is a lot of loss. And so I think we can't underplay that, people like, oh, they got to go back to work in 2 months. Well, 2 months when you are barely making it is everything, and the exhaustion of poverty really in this region. When you live check to check, the entire system breaks down. And so that's what we're experiencing, that while we've been able maybe to help with the rent and which is important, this interlocking system is not just rent. And so if you do lose, people that maybe got their jobs back, most of them did not get them all the way back, especially, the people that lost their jobs on the front end. They're working less hours and it's more sporadic. I think the first round, we saw people with some savings. At this point, there's no savings, there's nothing. And people are tired, they're weary of trying to figure this out. Additionally, I think we're finding fatigue in giving.
I'm
Yeah.
wondering if you can think of any examples in your mind of people you've dealt with who are showing up and you can just see the stress, and how do you react?
You can't just walk up because we get inundated with that. But somebody came up and I was by myself at the office and I said, sure, we'll just do it. Because, that's why we don't want them walking up, because it's so hard to say no. And she just stood there and wept for 15 minutes. And I just couldn't, and it wasn't, she was just the stress that was coming off of her. And, it was $3,000, and that was for, we got her upright and paid that month. People lost their jobs, and so there was that issue. But, and you guys probably see this as well, but now people are getting sick. I mean, before we knew people, but I live on a cul-de-sac, and 3 houses to the right, everybody's had it. And my next door neighbor has had it on both sides. So we now, and we now have experienced people that have lost their job, or gone without because of the shift in the economy, but now they're not working because they've had COVID, and whoever's in the house with you has to quarantine as well. And so that's 2 jobs out, and then if you get it, then it extends. So there's this effect. COVID is one thing, it's afraid, you're afraid of the illness, but the real issue I'm seeing is the long-term effects it's having economically on your family.
Well, let's talk about our kids. Gina, first, just a quick overview of what's open and what may be open in your vision of the coming rest of the school year and in the Ravenswood district. And then we'll switch over to what it's been like to have distance learning.
Sure. We have, like I said, 4 schools, 1 middle school. And we were able to open up our campuses with learning hubs that are managed by our partners. So we have the Boys and Girls Club managing learning pods at all of our sites. And then we have the 49ers Academy and the East Palo Alto Tennis and Tutoring at the St. Travis Ravenswood Middle School site. And the YMCA has also provided location to host some of our learning hubs. So we have about just over 200 kids that are participating in the learning hubs, where they receive the remote learning from their teacher under the supervision of an adult, as well as being able to have Wi-Fi accessible and meals that are provided. We just recently started a class for in-person instruction by their classroom teacher, and that is with a TK class at Castagna School of the Arts off of Fordham. So we have 10 of the 11 TK students who come into class and participate in school, delivered by their classroom teacher, instruction delivered by their classroom teacher. We have a teacher in the house. And their day ends at 1. And what's great is that the Boys and Girls Club then is able to provide extended care through their learning hub for the remainder of the day. So partnerships, I can't emphasize enough the importance of partnerships to be able to pull off what we're doing here in East Palo Alto and Eastern Menlo Park. We have another kindergarten class teacher who's willing to come in person as well at Castagna, and we have a couple other teachers that are willing to bring in their do in-person instruction with their students who are willing to come. Not all of the kids are willing to come. I should say not all the families of students are comfortable with coming in. I think we are going to continue focusing on bringing back the urgent learners and target that group of population of our students prior to bringing back any other cohort of students. We're trying to do this systematically. We're trying to do this collectively as a district. I'm not trying to create dissension. And at this point, I'm all about trying to build confidence with facts, information, with success to create the buy-in for individuals to recognize that schools are safe. They are safer.
When I talked to you in the summer, you talked about that the spring, when suddenly everybody had to pivot immediately as the schools closed down, you called it crisis learning, or that's what the teachers were calling it. And I'm wondering now, with the new school year that they're halfway through, is it still crisis learning? Is there some better effects now that the teachers are talking about, or is it really a difficult proposition for them to do distance learning?
Ravenswood has been trying to focus on the fundamentals, which is the instructional core, like just the basic fundamentals of good instruction, which is, are we teaching the standards into the depth of the standards? Are we engaging students, and are we using the best effective strategies? We can't cover all of these standards through remote learning. It is a challenge. Engagement has been a challenge, let alone now us wanting to make sure we teach culturally responsive content. So needless to say, our educators are a bit overwhelmed because they want to do what they were doing better, and now they really can't because there is this barrier, and that is this thing called Zoom.
Are the teachers okay with coming back, or are they
Okay, so
dealing with their own fears?
there's a range. There's a range, and that's why I emphasize like building the confidence with those who are willing to come back. I have my son in a learning pod, so I'm fine with him interacting as long as safety precautions are put in place. But there are teachers that are still wanting to do remote learning until there is a vaccine, right? Or maybe even hoping that students and staff are getting tested regularly before they come back onto campus.
Are you hearing from parents who are saying, please open the schools already? We're not dealing well with all the kids at home. Or are you on the other end of the spectrum? Are you dealing with parents who are saying, I'm not ready to send my kid back until everybody's vaccinated and I know the vaccinations work? What's the bigger message that you're hearing back from parents?
We actually did a parent survey to see what their willingness was, or their comfort level to be able to come back, or when to come back, I should say. And it's also a mix, but it's more heavy on wanting to come back onto campus sooner than later. So right now we're only really having over 200 kids, which is only about 11% of our student population. And we had about 40 to 45% of our families wanting to have kids come on campus. So we're not meeting the demand right now. But that also means we have several families that still want to do remote learning and have remote learning as an option.
One, when will all 1,700 children in the district be able to come back and go to school? And number two, you've mentioned, at least I read in the papers, that you mentioned we have a multi-year challenge ahead of us when we all get back because of the ground we've lost over the time when kids are at home. And if I've gotten that wrong, correct
No,
me, but go
you're
ahead
right.
and talk about both those
Yeah,
things and then we'll move on.
I honestly, if we have a vaccine in hand, then we can honestly have a conversation about doing a hybrid model. I don't see us necessarily being able to have kids on campus every single day. So it definitely would be a hybrid model. But I'm hoping that's what it's going to look like in the fall at the very least. So our kids are on campus 2 to 3 times a week. And our urgent learners hopefully more frequently. And in terms of learning acceleration, there's going to be a great need to address learning acceleration, and we've already started the planning for that, for what summer school could look like. We want to make sure that we have staff who are not compassion fatigued and exhausted, like Heather was mentioning, right? That are willing to step up to the challenge and really hone in on what it's going to take to have our students, to mitigate the academic and the opportunity gap that's been increasing because the lack of engagement or the struggles that we're having to revamp the curriculum and make it online format. We need to consider all options and be very creative when we're trying to address how we're going to reach 1,700 kids. They're going to need some additional support.
I'm going to throw a few questions to all of you. You don't have to answer, but if something comes to mind. I want to say that in previous talks with people about our pandemic lives, people have also mentioned some silver linings or some experiences that actually inspired them. Do any of you, does something come to mind of a person that you work with or an experience that was inspirational?
one of the things that has been really exciting is how our college students have really stepped up. So we were able to hire 2 of our college students to really run the Live in Peace side of the rent. So they kind of did all the interviews, and they just made most of the decisions. And then, we kind of wrote checks. And then in our
They were evaluating people who applied for rent assistance,
That's
and
right.
these are,
They did everything. Set
and
up.
how old are they?
They're 20.
Very good.
They set up the systems and Google Docs because we had not planned on serving that many families, and they're hungry to be a part of a solution. And they're also, I've just seen, all of us, I'm sure, have seen just this resiliency. But the college students, I am just so proud of them. And we know statistically that first generation low income students are dropping out of college, and I can say none of ours have. So they're really activated, and we're seeing this leadership.
For me, Elliot, if I could say,
Yeah.
it's finding, coming into contact with families and individuals that have found housing. Sometime one young man, he had been homeless for over 20 years, and he finally got in his own place. And some of the things that the ones of us that have not experienced homelessness, this young man said he had been homeless and living outside for so long, he had to get used to living in a house. He said he would stay out in the backyard, and he was blessed to find a place that has a little patio and everything. And we were blessed to be able to find patio furniture for him, but he's now, getting more comfortable sleeping in the house. But I'm surprised, even with this pandemic, how many people are finding, we're averaging about 3 different families a week that are calling in saying, I found housing, I need bedding, I need beds and things like that. And I'm really happy to see that, at a time like with everything else that's going on.
I'm also inspired by, I think Gina said it's all about partnerships, about how different parts of the community have come together and have, always problem solving, always trying to work on creative solutions. One program that I found inspiring was Great Plates Delivered, which was stood up by the county for older people, and was offering free meals to not just the lowest income people, middle income people. And it also paid restaurants to cook and deliver those meals. And I just remember stories about some of the restaurants, like there was a restaurant owner who just loved it. It was the most exciting experience of his life. And he actually kind of adopted some of the people. This was like in back up in the mountains, in what's the name of the community? It's just escaping me, not beyond La Honda. People that are older people in La Honda, and he would make special visits. He'd go visit them all the time. And, just this creation of community. And again, our staff, people, stay up till midnight getting appointments for people to get a vaccine. People really care and are really trying their hardest in a very difficult situation. It's really inspiring.
We have essential workers in our district who have been reporting to the job site since the pandemic started, and they have been there every single day. I hats off to them. That's our C&E workers, food service, custodians, our technology department, our maintenance operations transportation team. But specifically to recently, our campus relations coordinators, who job is to help supervise children, haven't really had that task, right? But they've been contacting families to ensure that we try to keep them engaged and inform them if their child's logging in or not. How can we support with any other services or resources? But recently, they've taken on the role of doing testing and helping us launch our pilot for antigen testing, which means that we can get a result within 15 minutes. And so they're preparing themselves to do this testing to test students that are on campus, for our students who are in learning hubs, and then the students we hope to bring back more so for in-person instruction. They're already testing staff through the PCR oral swab test. But now to do a nasal swab test for our students and to help us launch this new antigen test, hats off to them, because that wasn't part of their job description.
Anybody who's watching this video, if they want to know how they can help you. I heard Nevada say that people weren't bringing in as many blankets or coats. Tell us where to bring those blankets and coats, and any other way we can help Ecumenical Hunger Program, and then we'll go around.
One of the places that they can bring the blankets and coats is 2411 Pulgas Avenue, East Palo Alto. And this is warm blankets, especially largest sizes in coats, male and female. Also food. I'm always interested to see the lack of getting more peanut butter and jelly. It's such a basic food that people, if their PG&E is off, and everything, they can still have something to eat. So more peanut butter and jelly. And the thing that we didn't get for quite a while is beans, dry beans. And for some people, it's a real staple. You can do so many things with it. And that beans and rice. I'm gonna just request beans and rice, peanut butter and jelly, anything, soup in a can, a one meal cup of soup, things like that would be really helpful. And all of it can be brought by 2411 Pulgas. The street is closed off on one end, but you can always get in on Bay Road.
We could use money, quite honestly, just to get it to the people. And we turn it around within 24 hours. And so our website is liveinpeace.org, and you can access there the emergency fund. You can make sure that it's tied to that. And we'll make sure it gets to people, or for our pods where if somebody wanted to give us a meal every day, every once a week for our students, we would take that if a restaurant's interested or something.
How many are there?
There's about 50 on the day.
You were part of an amazing initiative called First of the Month that fundraised for people on rent assistance. Now, we did get some really good news yesterday or a few days ago from Governor Newsom that evictions there'd be a moratorium continuing into June. And there's a certain equation to how much you pay and how much the state pays, et cetera. But I'm wondering, you mentioned giving fatigue. And I'm wondering what happened to that fund of First of the Month.
We actually gave out 2.3 million. I think February we have just our last kind of dribble. I mean, not dribble, it's great, but you know, our last amounts. Right now we're giving 25% of people's rent, because that's the equation. People have to pay 25% of their rent. We're also hoping, you know, we're not sure what that means in June. And so if I would say, I encourage you to give, do not let up. We want to keep our community here and stabilized.
And let's go to the district, the Ravenswood district. How can people help?
Yeah, I think to be able to help our students, obviously they can't do it directly, but they could participate in volunteering to support with virtual tutoring. So we have different organizations that allow us to be able to offer virtual tutoring for students. So there's that. And
Is
then
that
we
on
also
the district website? How to sign up as a
so
virtual?
they can contact the district office. They can contact individual school sites. All Student Matters is the organization also that supports with virtual tutoring. So that would be helpful. There's also we have a foundation where they have also done a lot of raising of funds to be able to help us replenish laptops, for example. Technology devices are now a staple. It is a basic requirement, like paper and pencil now, for our students to be able to really, you know, access instruction. But I think more importantly, the Maslow needs of our students, you know, Maslow hierarchy of needs, the basic needs of our students need to be met. So I really encourage anyone listening to support EHP, to support Live in Peace. if our families' needs are met, we could focus on education.
So I don't want to end the program if any of you is sitting on something that you really feel you need to share.
If you're still looking for other organizations to give to, there's an organization called Mission Asset Fund, Immigrant Relief Fund, that focuses on giving a stipend to families that, one-time stipend to families, undocumented families that aren't eligible for any of these other programs under the CARES Act.
If I could just say to all of us, look out for the people that are dealing with depression. I've been really surprised to see, and I think I talked a little bit about it, how many people are dealing with depression during this pandemic. A young man, my neighbor's son, and sometimes we have to listen to what people say and what they don't say. My grandson had noticed he was speaking kind of strange on his Facebook and had his cousin to call him. He said he was okay. He committed suicide. And it seemed like everything that's going on right now, including, we spoke a little bit about racism. You'd be surprised for some older people, the feelings that is bringing up for them, the fear even of what that is bringing up for people. So for all of us that
Can
work
you
with,
say a little more about that? What are you speaking of?
the thing that happened even at the Capitol on the 6th, and seeing all the white supremacists come out like that. For some, quite a few families here in East Palo Alto are from the South. I myself is from the South. In this community, people talked about, be careful where your kids are. Don't let them be in an isolated place. These people are coming back and they're going to kill some of us. And with this racist attitude that's out there now, it brings up a lot of depression for people. And I mean, a lot of thoughts. We're worried that somebody might come in here and go to shooting because it's a lot of minorities here in this center here. So it's just things to think about. And it does bring on depression for a lot of the older people and young.
To the extent, if anybody's on Medi-Cal and they need counseling, call us.
Okay.
You know, send them to the Health Plan of San Mateo because we cover counseling and therapy.
When people watch something like that, and it's so horrifying and it is race-based, you see the flags, you see what's happening, you see who's not there. And to think that that doesn't affect a community of color, I mean, it is dripping, you know, and heavy here. And all those things feel like, well, where do I fit? You know, where do I fit in this world, in this state, in this country, in this economy? And I do see depression and a lot of pain, and that's why we have vehicles where we talk about it. Family night, we're like, hey, let's bring this up, because if we don't talk about it, we feel like it can just weigh heavier and heavier.
That's the real work. I know we don't want to go back to what we were doing. We know we have standards that we need to teach. It's how do we teach those that in context, with content that's relevant, practical, and teaches kids how to really be with one another. And I think we also need to focus more on civic responsibility. I think a lot of what we saw in the Capitol were people who were uneducated about just their civic duty. I learned that some of them didn't even vote. And if we could see themselves in the curriculum, we could see themselves as being leaders. There's more engagement, there's more diverse conversations.
Well, you four are all incredible role models for civic engagement and for care of the community. And for those who are watching, you know, whether you're part of the community and can relate to the stresses and see some of the resources that are there to support you, or whether you're part of a community that's much more fortunate and see that it's a wake-up call. We're all in this together, and however you can help, please step up. I thank you all for rejoining me and looking at the pandemic again from a more advanced, almost a year. And thank you for all the work you do.